And I was just wondering, to start with, Tali, if you may give us like an example of how you, for example, have worked with clergy or with a couple in order to navigate some of the particular types of restrictions. So when you talk about, sensei focus, something that we're all very familiar with and often use in our practice, with a couple that has enormous concern about restriction, about erection or ejaculation outside of the vagina. Just, it would be great if you could give us a little bit of a sense of how you navigate some of that.
Sure. So thanks for the question. I think before I directly answer the question, I just want to say a little bit about consent, and to make the distinction between cognitive consent, the idea of consent, and the experience, the emotional and physical experience, which often tells a different story. So it is important to when we talk to our patients about consent, and this is why it is so important to involve therapy, and many of them will say, at least on a cognitive level, this is what I want. In other words, they have a very strong intellectual and rational part of themselves that would like to do the right thing, that would like to have sex, that would like to please their husbands and be available for them. And they see this kind of disembodied part of them, their vagina, which is this organ that is not cooperating with what they actually want. And what ends up really happening is that when you are able to get into the more emotional and more somatic experience of the patient, and also explain to what happens in the amygdala, in the emotional brain, in their fight or flight center when they are confronted with the penis coming to them, and why they go into this anxious reactive state. They want to understand the dissonance between their cognitive part that wants so much to do this act, but that in fact they are experiencing trauma. And the more that they try and have sex, the more they experience trauma. And even if cognitively and even emotionally they don't necessarily experience their partner as coercive or as threatening, their amygdala is experiencing their partner and the idea of penetration as coercive and threatening. And the sad part about this is that the partner himself is in a dilemma because he doesn't want to be a perpetrator. He doesn't want to be in a position to force himself into his wife's vagina either. And so having kind of like this global understanding of what they are being expected to do in a way that they can actually understand it and bring it to clergy, or, because otherwise if they're talking to a rabbi and they're not having an understanding of their own emotional, they just say, well, we can't get it in, what do we do? And the rabbi says, well, you need to get it in a little bit in order that you don't, break the rule. And the little bit is right at the entry, which many of us know is the painful part when there's a vestibulodynia. It's at the entry. So just kind of getting it at the entry and leaving it there to ejaculate there can be the most difficult thing. And I have had situations where I've really explained this, and for the most part, I was listening to Catherine's, and of course it brings up a lot of countertransference types of feelings, difficult feelings, when you're confronted with the fact that there are women and men who don't have agency and don't have autonomy. But the truth is that's really not ideally the way Judaism works and the way the rabbis work. It's how the patriarchy works. It's how people use Jewish law and distort it in a way to promote their own power. So usually, I would say almost always, there are compassionate ways to work around these laws, and because I have spent a lot of time educating rabbis that you can't tell the woman ever that she has to. The minute you say she has to, and she needs to know that she never has to in order to be able to heal without having that autonomy over her body, her amygdala is going to continue to fire every time. And I've not really had too many problems. I have done a lot of work in this area. I've written articles geared to rabbis. I have a chapter in a feminist Jewish book there's a feminist Jewish organization, and they have a conference every year, and it's called I Am His Vessel, and the Impact of Ejaculatory Restriction on Women. And it was a plea to rabbis to please be sensitive and aware how women without autonomy cannot heal, cannot, if you don't feel like you're in charge of your body, obviously your vagina is going to lock. You know, your pelvic floor is protecting you because you don't have, you know, the ability to verbally protect yourself.